Vascular disease. Julian.
Thanks so much for the introduction, also for the opportunity to present my research or our research here. And I would like to point out that this is a joint project which is done together with Julian. I couldn't be here because of clinician services. And it's also a cooperation between Gießen and Frankfurt. So I would like to rule out that there's a strong link between cardiovascular diseases and also SARS-CoV-2 infections. And during the pandemic, it was shown that SARS-CoV-2 basically favors or contributes to the existence or development of cardiovascular diseases, while people having pre-existing cardiovascular diseases were then more prone to SARS-CoV-2 infections and also suffered from more severe infection types. So within the list of cardiovascular dysfunctions, what is quite obvious is that arrhythmias occurred after a SARS-CoV-2 infection or during the infection. And cardiac arrhythmias are also known to be developed because inflammations or cytokines can drive actual fibrosis of the heart and also alter the electrical stability of cardiomyocytes, resulting in arrhythmias. However, a growing body of evidence has showed that also autonomic nervous system showed dysregulations and dysfunctions after COVID infections, which happened in the post-COVID scenario. So the question that we actually were working on is, what is the mechanism underlying autonomic dysfunction in the post-COVID-19 syndrome? To answer these questions, we teamed up with Harold from Gießen to perform mouse studies. What we did here is to use first wild-type mice, healthy wild-type mice, receiving the mouse-modified SARS-CoV-2 strain MA10, and the mice were then just recovered for 28 days. As a second model, we used mice having pre-existing cardiovascular dysfunctions. In this case, we used LDL receptor knockout mice receiving high-fat diet before getting infected to develop atherosclerosis in these animals. After 28 days after infection, we collected the organs and performed histological assessments, and we found surprisingly that in the wild-type mice we don't see that much of an effect. But when it comes to the cardiac autonomic nervous system, so the sympathetic innervation of these left ventricles, we found that specifically on the right-hand side, cardiac innervation was robustly and significantly reduced in the left ventricles of the mice having pre-existing atherosclerosis after infection. Not only innervation was disturbed, also fibrosis was enhanced in these mice having pre-existing atherosclerosis, while the healthy mice that were healthy beforehand showed no fibrosis. To get a full panel, actually, we also assessed by using flow cytometry the immune cell makeup of the hearts of the LDL receptor knockout mice. We found that the recruited myeloid cells were not changed. However, we found a drop in the tissue-resident macrophages. The use of single nucleus RNA sequencing data on these mouse hearts revealed then, and specifically look at the overall population of macrophages, that when the most top downregulated GO terms of the macrophages after infection, we found axon guidance and nervous fiber GO terms to be downregulated. So this suggests, is our hypothesis, that tissue-resident macrophages might stabilize the cardiac innervation in the heart, and after the post-COVID or after infection, we have a loss or a reduction in the tissue-resident macrophages, leading maybe to a reduction also in the autonomic nervous system. With this, I would like to acknowledge not only the partner site in Frankfurt, so the institute from Stephanie Dimler, but also the institute from Sonja Harold, who developed the mouse model, and my funding partners, and would like to take any questions after then the panel discussion.
Thank you very much. Please come ahead. Next one is also from Gießen, also keeping the topic on cardiac and ventilatory inefficiency. Please, Dr. Oruqaj.
So thank you for the introduction. I'm honored to present here the data from our study insight from the PULVAS core study, specifically focused on ventilatory inefficiency and low cardiac preload in post-COVID associated dyspnea. As we all here mentioned many times, as the post-COVID syndrome is an heterogeneous condition affecting many organs. Specifically, we are focused here on cardiorespiratory symptoms, heart and lung, especially in dyspnea associated post-COVID. The aim of the study was the investigation of cardiopulmonary factors which are associated with post-COVID related dyspnea and exercise limitation, stratification of subgroups according to exercise limitation, and generation of subgroup-specific treatment approaches. The method in this study, this is a multi-center cross-sectional study including 4 main centers in Gießen, Berlin, Hanover, and Munich. We studied the 86 patients in the study involved, post-COVID patients and 12 controls, and we conducted a deep phenotyping by using different analyses like questionnaires, blood gas analysis, CPET, 3D echocardiography, vascucist, as well as then right heart catheterization in a subgroup of patients. The results, the post-COVID patients exhibit ventilatory inefficiency and impaired cardiac feeling, showing by the increased dyspnea index, lower performance, and lower ventilation, decreased PET CO2 levels, and increased ventilation equivalence for CO2 associated with reduced right atrium and systolic area index and right ventricle and diastolic area index with the reduced size of the right atrium and ventricle and the lower oxygen uptake. In addition, the association of the key functional markers like with the breathing frequency and forced expiratory volume and right atrium and systolic area index as well with the decreased size of the right atrium and the right ventricle. The mechanism is that the fast breathing at exercise, low lung volumes, and low preload lead to dyspnea, and low ventilation, and low aerobic capacity to reduce exercise capacity. So to summarize, post-COVID dyspnea and exercise limitations is a combination of factors, including ventilation limitation and preload insufficiency with subsequent tachycardia. And the phenotyping and grouping of these patients is very important, as was already mentioned, for the personalized targeted therapy, where we found the 3 different groups where with one group with the bronchial and left ventricular limitation, the first, the hypercirculation, the second, and the third, which was interesting with the VQ mismatch, low blood pressure, hyperventilation, and low aerobic capacity. By phenotyping these patients, post-COVID patients, we might lead to personalized strategic therapies according to the symptoms. And in the end, I would like to thank all collaborators who contributed, the whole centers in Berlin, Hanover, München, Marburg, ILH, and thank you for your attention.
Thank you very much. The next talk is by Georg Fritz Kurze from Dresden on parasympathetic inflexibility versus a potential central factor in post-COVID syndrome.
Yeah, first of all, I want to say thank you for the opportunity to speak here today. My name is Georg Fritz Kurze. I'm from Dresden. We are biopsychologists, a youth research group, and we focus on stress and exhaustion symptoms. That's why we want to understand the development and persistence of exhaustion symptoms following COVID. Our idea was to operate the neurovisual integration model, which proposes that the vagal control and therefore the parasympathetic nervous system plays a key role in the regulation and the reaction of an acute stressor or acute infection. Therefore, there's one clear hypothesis for us. We do believe that the parasympathetic inflexibility may impair recovery and amplify exhaustion symptoms after SARS-CoV infection. So in other words, we believe that it's not only about the intensity of the viral load or the viral infection, but it's also about the way our body and the parasympathetic nervous system regulates the reaction of this intensity. How are we testing this hypothesis in the study? So the COVIC study is short for COVID exhaustion study. As I said, we are psychobiologists, so we want to understand the perception of exhaustion and development of this perception, and therefore we are tracking the symptom trajectories over 1 year, starting in the acute phase after the infection with our participants, and then with 2 follow-up dates after 6 and 12 months. What are we assessing? We are assessing a battery of psychological questionnaires, including perceived stress, perceived exhaustion, ME/CFS, but as well physiological data in form of a 72-hour ECG, heart rate variability included there, as well as hand grip strength, hair cortisol, and other factors. We do hope or do believe that this is the best way to understand this really crucial point in time where the acute symptoms go persistent over time in this exhaustion. There's another study, which I want to give a quick outlook because of the time. It's a complementary insight. We did conduct 10 years ago the Dresden burnout study, so we do have a sample pre-pandemic, and we do have frozen blood samples and ECG before the pandemic arises or started, and we are reassessing the sample in October 2025, and we do believe that this multimodal approach with a retrospective and prospective view can help us understand development of exhaustion symptoms as of the view and the perception of the people who have the symptoms. Yeah, thank you. We are right now in the second wave, so preparing in June to start the 6-month assessment. So if you have any great ideas, we're open to it. Thank you.
Good afternoon, everyone. I would like to thank you for this opportunity.
Just wanted to introduce you, but go ahead.
Okay, sorry.
So this is Giovanni Vardiero from Tübingen, and yeah, go ahead, please.
Yes. Yes, I would like to present these ongoing studies on transcutaneous vagus nerve stimulation for improved recovery after exertion. As we all know, and we are here, yes, long COVID is a complex non-monolithic multi-system disease, and fatigue is one of the main symptoms present in long COVID patients. And very interestingly, also severity of symptoms is associated also, or fatigue is associated as well with severity of depressive symptoms and also autonomic dysregulation. And this autonomic dysregulation could also due to vagus nerve dysfunction, and it has been shown also there are morphological changes happening in long COVID patients, and there have been also pilot studies running transcutaneous vagus nerve stimulations and yielding a promising results on the ameliorating symptoms of fatigue. However, there is no established treatment yet, and there is a need for a well-powered and well-designed random clinical trial. And for this reason, we are currently running a single-blind randomized crossover designing with 120 participants that encompasses a baseline assessment with blood draws, questionnaires, and a motivation task. And after 6 weeks and 12 weeks of either high intensity or low intensity transcutaneous vagus nerve stimulation or treatment as usual, also we're gonna run the same sessions. And then during these periods of the intervention phase, we are going to ask the participant to apply transcutaneous vagus nerve stimulation on up to 4 hours daily, while we track also physiological signals and also mood changes with the ecological momentary assessment. And with this design, we are able to assess stimulation-induced changes on motivation, fatigue, and depression, with the aim to investigate the effectiveness of tVNS as a self-administered treatment at home to promote recovery. And in order to also investigate how the motivation works, participants are conducting the effort allocation task, where they have to raise the ball by pressing the bottom as fast as possible, and they need to bring the ball up on the above the red line, and when the ball is above the lines, also for each seconds the points are summed, and then we will compensate with a monetary compensation. And at the end of each trial, we also ask how much did they exert themselves and how much did they want the reward. As a baseline preliminary results, we saw that indeed participants are showing fatigue symptoms from mild to severe, and they are also highly correlated with depressive symptoms. And in order also to better visualize how this fatigue also interacts with the motivation, we divided this group in 2 subgroups, in higher and lower fatigue. And when we look at the performance of the AIT task, we can see that the participants with higher fatigue group, they do have an invigoration towards goal-directed behavior, which is much lower than the lower fatigue group. And also when compared to their subjective wanting of a reward. So to conclude, I would like to say that the effort location task is a useful behavioral tool to assess motivation-related mechanisms underlying core symptoms of long COVID, and that we hoped with this single-blind randomized clinical trial to shed light on the potential of vagal afferent stimulation to facilitate recovery. Thank you.
Thank you. And the next one is Rieke Baumkötter from Mainz. Risk tools for predicting long-term sequelae based on symptom profile after known and undetected SARS-CoV-2 infections in the population.
Thank you very much. I'm very happy to present the data of this project. First of all, I would like to point out that this project is funded by our several partners. Since there is still no diagnostic test or biomarker available, post-COVID remains a diagnosis of exclusion, requiring extensive efforts of patients and physicians. Therefore, the aim was to generate and prospectively validate data-driven scores for the risk and diagnostic assessment of post-COVID syndrome. For this, we use data from the Gutenberg COVID-19 study. This is a large population-based cohort study, and here SARS-CoV-2 infections were screened systematically, so we could identify unknown infections, and individuals with but also without SARS-CoV-2 received a standardized assessment on long-term symptoms based on the WHO post-COVID catalog. With machine learning techniques, we generated two scores, one prognostic score to predict the probability of developing long-term sequelae based on the symptom profile during the acute infection, and a diagnostic test to exclude post-COVID based on symptoms that discriminate between cases and controls. And due to the time, I will now only refer to the diagnostic test. In total, 21 symptoms were selected that discriminate most between individuals with and without a previous SARS-CoV-2 infection, with a cross-validated AOC of 0.66. Taste disturbances, brain fog, and dyspnea were more common in individuals with a previous SARS-CoV-2 infection, whereas mood swings, sleep disturbances, and headache were more common in controls. The test has a high sensitivity of 95% and a negative predictive value of 99%, so it's suitable to rule out the presence of post-COVID. We were able to prospectively validate the score in an independent cohort of around 20,000 participants in Rhineland-Palatinate, also during a time period in which newer variants of SARS-CoV-2 were dominant. So in conclusion, the test is quick and easy to use, especially in the initial management of potential post-COVID patients, as only self-reported symptoms are needed. The test is highly sensitive, so it's suitable to rule out the presence of post-COVID and to guide further diagnostics. However, it is not suitable to diagnose post-COVID, as symptoms alone are not sufficient for a diagnosis. And lastly, the scores will be made available to healthcare professionals via a web-based application. Thank you very much.
Thank you very much. And we come to the last presentation, which is given by Dr. Khatami from Mainz, Proteomic Atlas of Post-COVID Sequelae. Please.
Good afternoon, everyone, and I want to thank you for giving me the chance to be here. I'm going to present a result of a study that me and my colleagues in the PKI consortium did. So post-COVID syndrome affected around 30 to 50% of survivors. However, its biological mechanisms are poorly understood. So we we measured the 3,000 protein from the 500 SARS-CoV-2 survivor and analyzed the result with cutting-edge machine learning method. Our key findings are, we found that 235 proteins tied to 15 symptoms. Majority are unique, but some of them are linked to several symptoms like interleukin-1 alpha. Also, we found that distinct cluster of the symptoms correlate with a specific proteins profile, and the symptoms with similar protein profiles often co-occurred in the patients, for example, fatigue and shortness of the breath. Also, we found that protein signatures were associated with objective clinical tests, suggesting the diagnostic potential of this protein, including the cognitive test for memory symptoms. Also, we found that a pre-existing condition or risk factor may influence the development of the specific post-COVID symptoms, such as diabetes and the memory issue. And finally, we found that genetic predisposition also linked to the certain symptoms, for example, the cholesterol and fatigue. With that, we showed that the post-COVID sequelae or syndrome is manifest as a discrete symptoms cluster, each with its unique molecular signature, which show us to breaking it into a cluster could improve the understanding, the treatment, which this may pave the way for target therapies and personal medicine for post-COVID patients, which is our ultimate goal in our EPIC AI consortium. With that, I want to thank you, everyone, and happy to answer now or later any questions. Thank you.
So a big applause for all the young investigators. Maybe you come once in the front of the screen that we can also make a photo, and thank you very much. So I think you deserve the photo. Thank you very much. It was a wonderful talks, and good luck with your research. And we have time in the coffee breaks for questions. So, and I hand over now to Susanne. But I don't want to enter the photo.
All right. So, okay, thank you. Now,